right. Hi, everyone. I'm going to start out. Thank you for coming to MiHIN's The Download. It is 2:02. This month is we're really pleased to be able to welcome everyone to the August 2025 download because this month we're recognizing National Immunization Awareness Month, which gives us a chance to highlight one of the most important ways we protect our communities and strengthen public health through immunization data. Today, we'll be exploring the Michigan Care Improvement Registry, or MICR, and MiHIN's role in connecting providers, pharmacies, health systems, and public health to ensure accurate, timely, and useful immunization records across the state of Michigan. Next slide, please. My name is Joanne Jarvie. I am the Senior Director of Network Growth and Development at MiHIN. And I want to start by grounding us in MiHIN's role within our state. MiHIN is Michigan's state designated entity for health information exchange. What that means is that we provide the infrastructure and services that allow organizations across the healthcare ecosystem to share data securely. Our work touches every corner of healthcare in this state: public health, hospitals, physician organizations, payers, pharmacies, community-based mental health, social services, FQHCs, and the list continues to grow. That's my job. So if you are not yet connected to MiHIN, I'm coming for you. Our goal, why we exist, is to overcome the barriers of very siloed systems to reduce unnecessary costs and ultimately advance the health of Michigan's full population. Immunizations are one of the clearest examples of how the type of secure exchange that we facilitate directly benefits providers and patients alike. Next slide, please. So the goals of health information exchange. Health information exchange is a noun and it's a verb. When we talk about health information exchange, our goals at MiHIN are ambitious, but really practical: to reduce inefficiencies, to improve healthcare access and processes, to lower cost, improve outcomes, and allow providers to ultimately deliver more personalized care. As it relates to immunizations, this means avoiding duplicate vaccines, ensuring the right dose is given at the right time, and supporting families and providers with a complete, reliable record. It also means empowering public health agencies with population-level insights that can guide outreach and prevent outbreaks. Next slide. So if you think back to before health information exchange or before a statewide exchange, every organization had to connect separately to multiple partners, often through manual processes or duplicative systems. This led to wasted time and money. By connecting once to MiHIN, providers gain access to a whole suite of shared services, including immunization reporting. So their processes can be streamlined. One connection to MiHIN opens the door to multiple use cases and to all of your partners in a care team, improving efficiency for everyone involved. If we zoom in a little bit there, next slide, please, you'll note that we do connect to and are the trusted point of entry for data flowing into MDHHS, our Health and Human Service Agency. MiHIN is an infrastructure that is the source of entry to MICR, to Michigan Syndromic Surveillance System, to state labs, to data warehouses, so that MDHHS and Medicaid can access the data that they need to serve their members, to serve their constituents, to serve the full population of Michigan. If anybody, by the way, has questions, I'm not able to see the chat yet. I will be looking at the chat later. Shelby or Ella, if you guys have, if people are dying to jump in and engage, interrupt me. I'm all about being interrupted. I
This
interrupt
sounds
people all the
sounds
time.
great, Joanne. This is Shelby. I'll watch
So
for the
yeah,
chat and
let
I'll
me
let you know
know
if
if
there are any
there's
questions.
great, good, because I don't want to keep going. Sometimes like people don't remember. Anyway, stop me. Stop me if you've heard this before. All right, next slide. The long-term vision here is to create a learning healthcare ecosystem. That means constantly using data to adapt, to improve, and refine how care is delivered. When immunization records flow seamlessly, they don't just support individual patient care, they create opportunities for broader learning. We can help our partners monitor vaccine effectiveness, identify trends, and tailor interventions in real time. This is an example of how we turn data into action for the benefit of all Michiganders. We here in Michigan have a very generous and supportive payment and regulatory environment that supports our health information exchange. And in order to be able to participate in our health information exchange with MiHIN, you would be looking to send data, to contribute data, to receive data, to query for data or find data, or to use the data that we have in our system within tools, be that our tool or your tool that we can populate.
Joanne, we do have a question in the chat. Just not sure if everyone's able to see it, but it says, are commercial pharmacies like CVS or Walgreens connected to MICR?
Absolutely. They are connected through to MICR, and they also exchange data depending on who we're talking about, depending on which facilities and what use cases they are participating in. They send or receive or find or use network data based on their legal agreements with MiHIN. But yes, they certainly are contributing. So today I have representatives from our partner, MICR, here with me. I'm going to take sort of the lead role, but I will be introducing my partners. At the end or whenever they come up. Wendy, for instance, just came up and I think she answered the question. And we also have Sally, we have Sydney here. And if I'm forgetting anybody else, let me know. But I've got Mickers back here. So if I go a way that I shouldn't, we've got the experts in the room as well. Let's go into next slide, please. Let's talk a little bit about Michigan's Care Improvement Registry, otherwise known as MICR. Michigan has a long history of leadership in immunization information systems. The Michigan Childhood Immunization Registry started in 1998 to track vaccines for children. In 2006, it expanded to cover people of all ages and was renamed the Michigan Care Improvement Registry, or MICR. Today, providers, including pharmacies, are legally required to submit data within 72 hours. Before MICR, the green immunization booklet was the standard record. Many of us remember those paper booklets, easy to lose, hard to keep updated. MICR changed that by creating a secure, centralized digital record accessible to providers across the state. Next slide, please. MICR provides benefits at every level. For public health, it helps identify communities with low coverage and supports campaigns to prevent disease outbreaks. For patients and families, it consolidates data from multiple providers into one record, making it easier to follow the vaccine schedule and avoid unnecessary doses. For providers, it supplies real-time data to guide decisions, simplifies compliance for schools or employers, and generates official immunization records when needed. And critically, during outbreaks or emergencies, MICR allows rapid response. That ability to move quickly and confidently is only possible with a trusted statewide system in place. Next slide. So immunizations were actually MiHIN's very first use case when we began in 2012. That foundation was critical. The COVID-19 pandemic really underscored both the importance of and limitations of existing systems around the nation. We saw siloed, aging infrastructure, manual processes that couldn't scale, and legal barriers that slowed data sharing. At the same time, immunization registries became front page news, critical to understanding vaccination rates and ensuring equitable access. In 2020, only about 15% of the nation's IIS connected providers were linked to HIEs. Now, remember, MiHIN and MICR connected in 2012. In 2020, only 15% of the states were connected in this way, and that's far too low. Since then, we've been working to expand these connections, and immunizations remain a cornerstone use case for modernizing our data sharing infrastructure. Next slide, please. Okay, so we'll be taking questions and I'm looking for feedback here, but how do you currently submit data to MICR? If you have, do we have any people in the audience here who are currently just submitting manually? You can feel free to raise your hand. Shelby, what are you seeing?
No hands raised yet.
Okay. So submitting data to MICR is straightforward, but must follow certain steps. Organizations, we have a bi-directional. Perfect, Angie. I know that you do. You guys are models. We work to make it that way. Organizations first need to be authorized under Michigan's Public Health Code, and they must have the right agreements in place to meet HIPAA requirements. From there, they can submit immunization data in two ways, all right? There's manual entry through the MICR web portal or electronic data exchange, which is faster and more accurate using HL7 messages sent through MiHIN. That electronic method is what really drives interoperability and makes reporting sustainable at scale. Next slide. When providers connect through MiHIN, their immunization data flows automatically into MICR. That ensures vaccinations are recorded quickly and accurately, and it builds a complete immunization history for every patient. It also helps providers meet federal reporting requirements, such as meaningful use, without adding extra administrative burden. For busy clinics and pharmacies, that time saving is significant. Next slide. And our connection to MICR works both ways. Through MiHIN, providers can query MICR to see a patient's complete immunization history. Even more valuable, they can also see forecast, what vaccines are due, which are overdue, and which have already been given. This functionality empowers providers to make better decisions at the point of care, prevent missed opportunities, and gives families confidence that they are on the right track. So we have two data exchange solutions through MiHIN with the Michigan Care Improvement Registry. We have the ability, we give healthcare organizations the ability to automatically submit their immunizations to MICR, and we also help immunizations query for data from MICR. Next slide. They're looking ahead. MICR is undergoing a major modernization. The new platform will be more reliable, scalable, and user-friendly. For large organizations like health systems or school districts, the multi-tier hierarchy will make site management and reporting even easier. Built-in vaccine forecasting will provide real-time clinical decision support using ACIP guidelines to determine what's due or overdue. And that means providers don't need to toggle between systems or interpret complex schedules themselves. The system can do it for them. The modernization will position Michigan to better support providers, public health, and patients for many years to come. I wanted to give our partners at MICR the opportunity to give us any more information about their modernization. Wondering if a MICR modernization is new information to anybody who's attending today.
Hopefully it's not, Joanne. We sent a communication out last month. So
So if you are here today, and if any of you saw, amazing. So Angie's the best. She's from Mackenzie, just to tell you. If you are, if any of you have been receiving, loving this, guys. I can see the chats now, but I guess what I wanted you to know is if any of this information is new to you, let's talk about that. If you are not receiving information that you feel you need about MICR's modernization, how MiHIN works with MICR, we need to get that fixed. We want to bring you into the fold and any of your partners into the fold. I'm going to go through here very quickly, sort of the steps to connect. And then I'm going to go off script and take some time for questions, for comments, to go into dig into other areas that you want a little deeper. So next slide, please. Thanks, Wendy. Perfect. Okay. So to connect to MICR through MiHIN, it really involves a sort of what we've broken down into a 5-step process. There is first the eligibility. You have to confirm that you're a MICR, that you've registered with MICR and that your EHR is certified, that it can, that you can participate in the ways that you need to. Then you have to, again, register, complete the HISTOR registration and the MiHIN onboarding steps, which include signing legal agreements with the Health Information Exchange so that we can be the conduit to our partners at Michigan at MICR. And this is an important step because it really gives, it really protects the whole system. It really creates a trail of trust, so that if anybody is asking how information is being passed from one entity to another, if it's coming through MiHIN, we have all of the signed legal agreements, making that sort of making it legal and taking away the risk. After you do the MiHIN onboarding legally, you will be work to be implemented, which means we'll work with you to set up VPNs, assign ports, and get you to test those initial, what we call VXU messages, those immunization messages. You'll be working in step 4 through data quality assurance with MICR analysts on that data flow. They'll work with you to make sure that the data, that everything's coming through that they need, and that you can resolve any data issues. And then finally, after message headers are finalized and documentation is complete, you will be sort of switched to go live. You'll be pushed into production. This process ensures that by the time data flows in production, it's legal, it's accurate, it's secure, and it's reliable. I will say here that often healthcare organizations work with their EHR or their source system to get this data moving. And MiHIN can work with whoever you need us to work with. at the implementation stage, right? Once we are setting up those VPNs and assigning ports and we're moving into the testing of those VXU messages, that's when we're really focused on working with your vendor. But up until that point, the registration and the legal onboarding with the information exchange, that happens between MiHIN and the healthcare entity. That does not happen between MiHIN and the vendor the healthcare entity has selected to transport those messages. We often get outreached to by a vendor. And there is a time and place for us to be working with that party, but we have to be working with the underlying healthcare entity as well, both MICR and MiHIN, to educate, to train, to legally bind before we can actually technically allow the data to flow and to make sure that the data quality is there. Of course, yes, Tina, MiHIN works with Health Focus, which is a vendor in the physician organization space. So, and when you onboard to, yeah, absolutely. When you onboard to MICR or when you come to MiHIN, we've really been working to coordinate and make sure that every party knows sort of what step they're at in the process. And we've been really trying to streamline that process. Next slide, please. Okay, so for those looking to take a deeper dive, we have a lot of resources. MICR's homepage was provided, I think in the chat, we have it here. MiHIN also offers detailed documentation and support for our immunization use cases, including history and forecast, which is that ability to query. There are also national resources. I had used some information from ASTO's environmental scan, that provide context on how immunization information systems and HIEs are working together across the country, sort of led by the work that MiHIN and MICR have been doing for years and years and years and years. These resources are there to help providers, health systems, public health partners take full advantage of all the tools available through our infrastructure and through our learning ecosystem. At this point, I am going to stop talking at you. I am going to invite you to come off mute, to ask any questions, to make sure that that we have reached all of the learning objectives that we were supposed to hear, and just to find out more about how you're working with MiHIN, how you're working with MICR, or give you the opportunity to connect with any one of your MICR partners. Let's see. I am seeing. Okay, so Oleg, I can always count on you for the deep diving questions. Maybe you can come off mute and tell us what you're thinking.
Sure. Thank you, Joanne, for opportunities. I always like to speak, and so now you're in trouble. Basically, again, the question is the same that I have for many interoperability use cases that MiHIN is offering. And specifically, we engaged with MICR team last year, and due to the limitations of the old platform, and we were told that they are moving to the new infrastructure, to the new platform, and this issue potentially can be resolved. But what we heard, that unfortunately the current deterministic algorithm that rely on a perfect name and a date of birth matching creates a significant number of the duplicates, and this is where the issue of missing immunization records can be coming from. So I was hoping that you will have some details how the new platform perhaps will use a different matching algorithm, but most important, to improve the matching rate that currently we're experiencing, at least with other use cases. Thank you.
So I can speak from MiHIN's perspective. The way that we interact with the MICR system doesn't it doesn't take into account any of our common key. It doesn't use our common key, and it doesn't currently use acres. So QBP also is a way to query, and that querying capability is supported by MICR's underlying system. I think that there have been, through our MiHIN Operations Advisory Council, I know that many provider organizations, physician organizations are looking for a way to sort of bulk query for all of the patients or members that you are responsible for. And I would invite Wendy or someone from MICR to talk a little bit about how any of your, the querying or patient matching capabilities are being enhanced by STC.
Sure. I'm going to turn my camera on so I can see folks too. Hey, everybody.
Hi.
I'm Wendy Nye. Hi. I'm the data quality and support unit manager for MICR. And my team that works with data quality and HL7 onboarding and QBP are also online to correct me if I misspeak. STC is our new vendor, and they have a consortium of states across the country that they work with. I believe they're up to 17 states. We will have that consortium leverage when we look at updates to our system. And remember, MICR is very old, very, very old, which is part of the reason why we're modernizing. And the new system does have much better algorithms for matching. I can tell you, though, that we did recently do a data cleanse. We are in the process of having our epidemiologists review that information and ensure that our internal business rules are accurate and that we are not doing anything crazy to any records when we merge those. A majority of them are adult records, honestly. The children records, because of responsible party permission issues, we didn't do a ton of matching other than death records, to be honest. So Oleg, you may see within the next couple of months a little bit better data quality in MICR as far as some of those duplicates. And it will definitely be better once we move to the modernized system. As far as QBP, one of the things that we found some of our various EHRs are experiencing is one of the things we're seeing that causes duplicate QBP responses is we, because our system is old, look at vaccine series and we don't drill down to specific individual vaccines. So if you are sending CVX for a specific vaccine, oh no.
Wendy, I see you still, and I hear you
Okay.
still. Yeah, you're
I
up.
lost connection on my
Oh,
laptop
no.
for some reason.
I know,
Sorry,
you look
guys.
so
It went
sad. No, we're
black.
totally here.
Yeah. So good thing I didn't say any bad words. So in our system, we do recognize the way EHRs send us information for QBP, it could cause a duplicate response. That hopefully will be corrected with the modernized system as well. And as we move through the modernization process, we are finding, things in the system that have always been there that now we're looking at it and going, that explains why certain things were causing issues. Our current vendor for our homegrown legacy system has been amazing. And our new vendor, STC, is also fabulous. They're working very closely with us to make sure that we have all of our ducks in a row when it comes to our business requirements and our product before we release. So, how do you define a duplicate response? I would define a duplicate response as getting two. If you are defining it a different way, please let us know so that we can dig into that, because we would be interested to know what you're seeing if you haven't already reported it.
This is Joe.
Hi, Joe.
I have not seen the duplicate responses, and I'm curious,
Okay.
if I'm actually receiving them and not recognizing it. How do people know that they're receiving duplicate responses? Like one
Sally?
matches and one doesn't? Like one matches their EHR and one doesn't match? Is that what's happening?
I'm going to have Sally, who is our QBP expert, answer that question, Joe.
Or Oleg, how do you experience duplicate records?
We experienced duplicate records when we got an access to the MiHIN, and we could see that the record can be under the different last names, same patient, different last names, but they never merged together. So this is kind of our experience.
Okay.
Another example will be different spelling of the name with the prefix, suffix, or abbreviation. Because again, people unfortunately register in a different system with a different spelling of the name. And this is how we had a couple examples of duplicate records on a MiHIN site.
Yeah, I see a lot of those. For instance, somebody gets married and changes their last name.
Yep, we see that as well.
But I also see matches on patients that have different genders and different birth dates. And that's problematic for our Epic system because our Epic system is set like to store when there's a high threshold match. And so we never reach a high threshold match on those patients and they all get kicked out. And so for practice to try and resolve that issue is a very tough thing, right? They don't get all of the information that they need to follow up to resolve it because they're not seeing what I see from an interface perspective.
Exactly. Sally, I saw you come off.
Joe, I have a question because I know query is supposed to give you an error when you get more than one record. It should be 2 TM, too many. And then you go into MiHIN and look up the patient that way. So Joe, you're not getting a TM when you query, or too many for query for QBP?
I don't recall seeing a TM. Is that like in the acknowledgement?
Yes.
Where I would say
Yes.
like an AE for application
Yes.
error, I would see a TM. I
Absolutely.
can do a search and see if I've received any of those, but I don't recall.
Okay, so you
I do
should.
review my errors and I don't recall
okay.
seeing TM.
Yeah, that shows that the QBP is working. If you have more than one record with two names, the same birthday, same address, or you should get a TM because we only match one. We don't match multiple, not yet.
Okay. There's a new feature in Epic, and I had emailed Sydney before and kind of chatted about it that Epic can receive multiple like low threshold matches in one message, one response. And we can prompt the users to manually make the match and say, oh, patient number 2 is the actual match. So then it would requery into patient number 2. But Sydney had responded that that's not a current feature, and it sounded like it wasn't going to be a feature with the new system, STC.
I have to leave that to Wendy.
Yeah, I can address that. Kind of. So yeah, Joe, I hear what you're saying. And the state is very protective of our citizens and their data. And right now, they're not entertaining the idea of anything other than a one-to-one match. That doesn't mean that can't change over time. As we move forward in the modernized system, we may see opportunities to reopen that discussion and revisit. So I'm not saying it will never happen, but right now it's not one of the top priorities.
I'm wondering if there's a gender mismatch or birth date mismatch or, last name mismatch, if it makes more sense to, in the response to, just not have a match.
Yeah, I agree. I'm going to go back and have them check on that, because that is something we're finding as we're cleansing the data. Like I said, we're finding some of these old codes that are popping up for various records, not necessarily an exact pattern. And the system is almost, 25 years old. So it's something that will get better with the modernized system. Right now, like I said, we're cleansing data, but because it is an old system that's going to be sunsetted, we're not going to be making too many changes in the system before we do move to the modernized product. So just to be very transparent.
That makes sense.
Yeah.
There was a query sort of in the Q&A section of this portal, and I just wanted to, I don't know the answer to it, but I thought it was a good question. The question was, is being able to query or immunization QBP required for meaningful use?
Yes, because that's how it was in the beginning. To get dollars, for the sites to get the dollars from Medicare, Medicaid, or whoever's giving them money, they had to do QBP. They would start with VXU, but then once they did the QBP, they would get the monies. So yes, so I think that's over with, right? No more of that.
Meaningful uses, but Medicare does have a component to immunizations. So I would honestly recommend checking with the Medicare, Medicaid folks at CMS to find out what their requirements are.
That was an anonymous question. And if that anonymous person wants to work with MiHIN on, at our compliance level, we'd be happy also to do that with you. I don't have my compliance people on today, but certainly part of our role is to help you meet all of your measures. And so, we can also funnel this through MiHIN if that person is interested. Joseph, remind me where you are from, where you work.
Hurley Medical Center in Flint.
Hurley, yes, Hurley. Okay. Ask us another question. You've got the people.
Thanks. So we receive an AR, or application reject acknowledgement, when the MICR system is down, right? When we acknowledge you have to have downtimes and, expect that. It's difficult for us to handle the AR because I don't automatically resend the vaccination once the system is up. I don't have an automated way to do that. And so I have to pick through a database of, rejects and determine which ones need to be resent. And it would be better on my end if you just stop the interface. Instead of allowing the message to be received and saying, oh, I can't do anything with that message, I'm going to reject it, just not receive it. Because I'll automatically connect once you bring the interface up, and I'll start sending what I have in queue.
Okay, so you do queue. I was going to ask. Okay,
Yep.
That's a great suggestion, Joe. Thank you.
Wendy, we have all of this recorded and we'll be sharing the transcript. So it'll be good for your teams, it's just a lot of learning, and I just have to thank you everyone for your engagement. Does
I,
anybody?
I am working on a feature in a new feature in Epic right now that allows the responses from MICR to go all the way back to the EMR. So when they're
Nice.
in the immunization activity, they'll be able to see what the response was. It's not in place right now, and so I don't know exactly how much detail they're going to see. Like if it says, you know, there was something wrong with the CVX code, or you know, lot number
Great.
or whatever, right? But
That's amazing.
yeah, in the HL7 acknowledgement right now, I don't usually see now all of that detail, and I think a long time ago I did see it, and now I think there's a reduced amount of info in the acknowledgement as to what went wrong. They'll just say like AE, you know, there was a
Yep.
problem storing it.
Yep. Those will
But
get better. So within
yeah,
our
if it said
releases.
like AE, you know, couldn't match a patient, or CVX, lot number, whatever problem.
Mhm. I think
Yeah,
that's
but
great. Yeah. Sending that all the way through to the EHR would be amazing. Virtual high fives on that one. So
yep, we hope to do that by later on this year.
yeah, keep us posted.
Yep. You know, I'm all for whatever I can do to give the end users as much information as I can to help them resolve the issues.
Great. Thank you for
Well,
that.
yeah, and Wendy, I would say, you know, this list of attendees and these, our experts here who are highly engaged, they'll be great for you guys along the way. It sounds like, you know, having
Absolutely.
some pilots and just having your people that are really interested in working on this with you, we are lucky to work with them too.
Absolutely. And as part of modernization, Joanne, we will be working with both vendors and our providers because we're a homegrown system. We're used to working very closely with our providers. STC has really close relationships with their vendors. So we're going to mesh the two and hopefully have the message coming from the top down and the bottom up so we can meet in the middle.
Goal is for the technical infrastructure to
Absolutely.
support the human infrastructure, which is, let's
Absolutely.
just make that always the goal. Let's let the humans lead. And we really appreciate that about our state and about our health and human services. So thank you. I don't have any more slides for today. If anybody has any questions or concerns, now is the time. Or I could just say thank you so much for working with MiHIN, for coming today to support you know, your health information exchange and to acknowledge Immunization Awareness Month in these crazy times. So I guess I'll close it out, give you 15 minutes back unless anybody has anything for the good of the group.
Thank you, Joanne, and your
Thank
group,
you,
and
Sally.
all those who attended. Thank you so much.
Yes.
Thank you,
Thank you all
everyone.
as
guys.
well.
Thank
You
Yeah.
know
you.
where to
I
find
appreciate
us.
it.
And Wendy, if you ever want to reach out to do testing, I'm game.
Absolutely, Joe. Yes, if
Okay.
anyone is interested in being one of our change champions in the field, please let me know or let Joanne know, and she will make sure that we get your name. So we're
We've
coming
got
for
your
you,
name.
like
We
she
are.
said.
We are. We've got you.
I'm
We got you.
confident in you, Joe. I'm confident in you because I like
Okay.
working with you.
Thank you, Sally.
Bye-bye.
Thanks, everyone. Be well.
Bye-bye.
Thank you.
Bye.
Bye-bye.